Hey, Dr. C here with you. So this is the fourth step in your path to thyroid recovery, and this is about the comorbidities. That's a big clunky word. I've never found a better, shorter one, but these are conditions that are present for many people who have thyroid disease. Other conditions, they're not thyroid disease, but they can affect you. And these are important because so many people with thyroid disease, they go on meds, they change their diet, they do various good things. Maybe they even improve their thyroid levels, but so often they fail to do better. And this is the big reason why. Over 90% of those with thyroid disease have additional medical problems. And in many cases, more than one. I'll talk about these things individually, but it's common to have multiples of them. And these are called the comorbidities, the thyroid comorbidities, and they're super common, and they affect you directly. They themselves can cause symptoms, but they also affect your thyroid, meaning they're more apt to cause thyroid disease, but also they disrupt how your body uses thyroid hormones. So even when things are fixed with your thyroid, these can cause big problems for you. I'm going to talk about just each of them and just touch on briefly. But first, I want to talk about how you might know which ones are most likely based on symptoms. So here's a way to think through that. If your big symptom is weight, if weight's been a big struggle, think about fatty liver, think about prediabetes as some of the top ones. If it's been fatigue, boy, almost any could be relevant, but think a lot about anemias, the latent iron depletion that I'll talk about, heart disease, kidney disease. If you've had sleep issues, think about apnea as being a common culprit. If digestion's been a big problem, gas or bloating, think about inflammatory bowel disease, irritable bowel syndrome, parathyroid disease. If hair loss has been a problem, think a lot about anemias, the low iron, think about polycystic ovarian syndrome, androgen levels. If chronic pain's been a thing, think about arthritis, fibromyalgia. And if mood or depression's been big factors for you, consider your adrenal health. Think also about celiac disease being a risk, and also think about body weight. This is one I'll touch on, but just the weight itself can be a driver of many symptoms. So I'm going to touch now on each of these top 15 comorbidities. There are some others, but these are things in which there's more than 5% of people with thyroid disease have every individual one of these, not all together, but the rarest of these affect at least 5% of those with thyroid disease. The commonest affect more than 84%, but collectively more than 90% have at least one, and most have multiples of these occurring at the same time. The first one to mention is apnea, sleep apnea. Now, this is something that, I don't know, I think we're quick to assume is a problem of older men that have giant bellies, and then that's about it. But no, the age, the gender, the belly shape, those things are predictive, but people of all ages, sizes, genders, and shapes can have apnea. It's extremely common. If you cannot get to sleep well, cannot stay asleep, do not get refreshing sleep, you're tired during the day, you get brain fog, think a lot about apnea. You might be even more suspicious of this if you're told that you don't breathe well at night or you snore quite a bit. But we've got data saying that those with Hashimoto's thyroiditis and hypothyroidism have more than 3 times the rate of obstructive sleep apnea as the general population does. What are your first steps with that? You know, see a sleep specialist, do a home study. You can do sleep lab studies at home now, and sometimes they're all you need. So they're good and they're readily available. Next up would be anemia. Now, anemia is a broad category, and there's a spectrum, there's a whole continuum of it. The mildest version is called latent iron depletion, or LID. Also same acronym for low iodine diet, but yeah, latent iron depletion. Now, I mention that because in most cases when someone's anemic, when they actually have a low amount of red cells, low hemoglobin, hematocrit, that's more commonly diagnosed and addressed, thankfully. But people can have the mildest stages of this and still have pretty significant symptoms, and that shows up with latent iron depletion. This is especially likely for someone who's having heavy menstrual cycles, hair loss is present, there's some fatigue present. And yeah, we've seen data saying that over 84% of those with thyroid disease have some version of this. How do you screen for this? Well, iron panels are appropriate. Ferritin specifically is the first thing to dip below ideal when this is present. And below ideal, I didn't say below range. There's good data saying that if ferritin is below 100, you may be symptomatic because your thyroid and ferritin interplay quite a bit. If this is low, you also want to sort out why. It's important to understand the causes behind any anemias or latent iron depletion. Next up would be celiac disease. And this is one, just having thyroid disease, you ought to screen for celiac disease. The two are more common together. This is suspicious just from having thyroid disease again, and your risks are anywhere from 2 to 5 times higher just because of that. With celiac, couple things to know. Good to screen for. You can't really accurately screen for it when someone is gluten-free. So if going gluten-free makes a big difference for you and you're doing it, so be it, but just know that you can't screen well for celiac. If you do consume gluten, you're better off screening for celiac on an annual basis. It can develop and it can show up over time. So why not just go gluten-free anyway? Well, the odds are likely that you don't have celiac. 97% or so people don't have it. The other problem is that if you are gluten-free, you can't screen for celiac accurately. And you'd want to know because the level of avoidance, but also the kind of medical care you need if you have celiac disease is not the same as you would need from just going gluten-free. So it's good to know if you have it. Next one to mention is chronic kidney disease. This one, if there's any abnormalities with kidney labs, this is a case to where appropriate medical screening is good, and this does show up rather readily at the earliest stages. So don't ignore if those things are abnormal. There's been data saying that 55% of people with hypothyroidism have abnormalities for kidney function. It's a big deal. What do you do about that? Well, managing your hypothyroidism, but also following up with appropriate renal care if needed. That can mean closer management through a lifestyle, diet, whatever's needed, of blood pressure, blood sugar, fluid, electrolytes, but this is a critical part of feeling well. Next up is cardiovascular disease. This is common, especially if you have chest pain when you're doing things and pushing yourself hard, if your lipids are high, or if there's been a family history of heart disease. Data suggests that those with thyroid disease have 3 times the risk for heart disease. What do you do if this is suspected? Look at this more closely. I like calcium scores. These are ultra-fast coronary artery CTs. They can usually be done without a doctor's order. And have one done. Do a good screen. Follow up with a cardiologist. Look for one that has more natural options available. But be aware of this if it's present and don't ignore it. Depression and anxiety. Now, this is a big thing. This can be suspected when there's fatigue, when there's unexpected pain, or past diagnosis of mood symptoms. Studies suggest that these can be present in 69% of those with hypothyroidism. Super important. Now, there's a lot of complex relationships to where thyroid disease can cause anxiety and depression. And anxiety and depression can cause thyroid disease to cause more symptoms. So either can be a chicken, either can be an egg. They can be enmeshed in ways in where it's impossible to know which is which. But many with thyroid disease have anxiety or depression, and it needs additional treatment or management. So what do you do with this? There's some good surveys that can start, but you want to really start with a primary care doctor and make sure it's being addressed. There are many effective treatments that can involve lifestyle and diet and exercise. Exercise is huge. But if you do have it, don't assume that just treating your thyroid will make it go away because it may not. It may require treatment on its own, and it's worth it. Next would be diabetes and pre-diabetes. We suspect this when we see higher levels of blood sugar in various ways, morning fasting glucose or 3-month blood sugar average. 51% of those with thyroid disease are likely to develop some version of diabetes. Now, this is something that's very treatable in nearly all cases, and this was the focus of the metabolism reset diet. Talk to your doctor if you have prediabetes, but look at the guidelines in the 28-day metabolism reset challenge. Most can slow the progression and many can reverse it just by that. And doing so is important. This affects many other symptoms as well. So, digestion, inflammatory bowel disease, irritable bowel syndrome, If you have marked gas or bloating, don't think that the only solution is to make your diet stricter and stricter and stricter. Sometimes a strict diet can help, even if that's not the cause. Kind of a weird thing, but imagine this. Imagine that you had a twisted ankle. Not walking could make your ankle feel better, but that's not the best long-term solution. And it's the same way with digestive problems. One study showed that 100% of those with hypothyroidism have disorders of gut motility, meaning that the sequence of nerve firing did not work right for them. So it's great to have thorough evaluation. There are many ways in which we can see that IBS, IBD can be treated, can be managed naturally, but know that just restricting your diet further and further, even if it helps, that's not the best long-term solution. If your diet gets too restrictive, that can hurt your intestinal tract further. You can compromise your bowel flora and dig the situation in even deeper. Next up would be a hidden malignancy, so some type of cancer. Now, this is the thing. There's about an eightfold increased risk for non-thyroidal cancers in those with thyroid disease. You want to screen for cancers. You want to do appropriate age-related screening. You also want to be aware of any signs of hypercalcemia, high calcium on blood tests. You want to watch liver function tests, your blood count. You want to watch for signs of this. But know that these things can happen and they can cause hidden symptoms. And you want to know at the earliest stages if anything like that is present. Next one's fatty liver. This is crazy common. There's about a 393% increased risk for fatty liver with thyroid disease. We suspect this when someone has a height to waist ratio that's greater than 0.5, meaning that the distance around their belly button is more than half of their height. Also, when liver function tests are high normal or above range. This is something that, like prediabetes, often is reversible with the metabolism reset diet. Next to mention is obesity. And I would call this overfat, not overweight. It's too much fat, and it's too much fat in the wrong places specifically. In most cases, people are aware of this, but there are those that are at a good scale weight but still carry toxic fat. And we know that there's a much higher rate of obesity with hypothyroidism, like 30% higher. A really big point I want to flag here is that the weight itself, this is not just a comorbidity in terms of a health risk, this is a huge driver of symptoms. So, those who struggle with fatigue or depression or sleep problems or chronic pain, the weight alone can cause that. And I've got to say, it breaks my heart. I've seen so often to where someone they're heavy and they don't feel well, and doctors just run them through the ringer on all these exotic things they test for and look for to explain their symptoms when it was just the weight all along. That extra weight is a bigger driver of inflammation than almost anything you could imagine. And when it's there, not only should it not just be suspected, it should be the top three suspects for most ongoing symptoms. So take it seriously, know that it can affect your health, and know that it's worth addressing. Next one would be parathyroid disease. Now, this goes both ways. This can be overactive or underactive. It's most common to see overactive, but if someone's had thyroid surgery, both are quite common. And this can be a big driver for fatigue, anxiety, digestive symptoms, joint pain, those calcium elevations we mentioned. There's about a six-fold risk for parathyroid disease for those who have thyroid disease. It's important to know that high calcium and high normal calcium can be the cause behind that. If you ever have calcium above range, that needs to be explained. That is not ever normal, but this is very important. And the only treatment is surgery, but with a good surgeon, it's a very minor procedure and it can be life-changing. Next one would be pulmonary disease. There's about a 22% increased rate of chronic obstructive pulmonary disease for those with hypothyroidism. This is more probable for those who've had a history of tobacco use or who have breathing issues or significant bronchitis. Good thing is to do pulmonary function tests as part of your annual screening and follow up with pulmonary care as needed. Last one to touch on here is thyrogastric syndrome. This is also called atrophic gastritis. We think about this for someone who has marked digestive symptoms, especially heartburn, gas bloating, bowel irregularities, along with low levels of iron. This affects 40% of those with Hashimoto's. It's very common. There's blood markers that screen for that. There are also further diagnostic steps needed if someone looks like they have some damage going on, but critical to identify and treat. So those are the top 15. This was not comprehensive, but those were a lot of things, right? And I don't know, if you're a normal person, you probably found your head going up and down at a couple of those. These are not rare type scenarios. This is why it's critical to work with a good diagnostician. You want someone that can really understand these things, understand how they relate to thyroid disease, understand how to screen for them, how to test for them more definitively, and then how to treat them naturally if at all possible. This is critical for you feeling your best. Okay, next up in the series, we'll be creating your own comprehensive game plan. Dr. C here with you. Take great care, and I'll see you really soon.